All right, so as we start this, notice this is black and white. My printer's out of ink, and I need to get this lecture done, so we're just going to make this as painless as possible with black and white here. Sorry, I'll post these notes in color. So before I start talking about genetic disorders, typically, one of the things I make sure that I tell everyone is that you need to remember that anyone who has a genetic disorder, there's nothing that they can do about it. There's nothing funny about it. There's nothing gross about a genetic disorder. All the things that over the course of my years teaching this, that there is sometimes someone who makes a comment that is extremely inappropriate. So as I go through this, I just want you to remember that there could be somebody that would sit next to you in class that may have best friend, family member, somebody that they know that has some of these genetic disorders. And that leads a really tough life, or maybe somebody's lost a child that's young because of a genetic disorder where kids don't live very long. So this is not something that we should take lightly. And sometimes there's somebody that, has comment to make that's just ugly. So I'm just kind of letting you know that. The other thing I usually mention is that sometimes when women are pregnant and they lose a pregnancy and they have a miscarriage, sometimes that's the result of the fact that whatever the problem with the chromosomes is, that it just isn't going to work and it's not going to produce viable offspring. But not every miscarriage is the result of that. But just kind of point that out, okay, that sometimes chromosome abnormalities don't end in or don't result in viable births. Everything we're going to talk about, babies have been born with these particular genetic disorders. So that being said, let's get started. So notice it says that genetic disorders can be autosomal disorders or sex-linked disorders. So remember, your autosomes are chromosomes 1, and I know this picture's tiny, chromosomes 1 through 22, okay, and then you can see that's the X and the Y, right? So the sex-linked disorders will be associated with that pair. If it's an autosomal disorder, it's associated with chromosomes 1 through 22, okay? In some capacity. We're not going to worry about specific chromosome numbers with some of these. Genetic disorders may be dominant or they may be recessive. Like, remember, alkaptonuria was a recessive disorder. They may involve a single gene, like alkaptonuria. They may involve multiple genes or an entire chromosome. They may be mild, like alkaptonuria. People live fairly normal lives with that, with few complications, or they may be very severe and maybe lead to early death. For some genetic disorders, prenatal testing can be done if there's a reason to do so. All right, so the first one we're going to talk about is one that a lot of people are familiar with, and that is, let me scoot where we can't see Patel. Trisomy 21 or Down syndrome. This is where somebody has an extra chromosome, so they have a total of 47. That extra chromosome is on pair 20 or chromosome number 21. Okay, so it's trisomy 21, Down syndrome. People who have trisomy 21 have mental or cognitive difficulties. Sometimes they have some kind of characteristic shapes to their eyes and their joints and things like that. Their eyes tend to be described as being almond-shaped. They have kind of loose joints. Their head is typically smaller in relation to the size of their body. A lot of them are really friendly and loving. They have decreased muscle tone. They have a single line across the palm of their hand. So when you look at your palm, you have a lot of different lines going in different directions. If you went to a palm reader, they might tell you what they mean. But they have a single line that goes across the palm of their hand. So just if you were to kind of picture from, well, I'll put my hand down here. Basically, they have a single line that goes right across here, okay? And then tend to have some heart defects and some other physical difficulties as well. Okay, but again, that's an extra 21st chromosome, so that's the result of a non-disjunction in chromosome pair 21, okay, or chromosome 21. Trisomy 13 is called Patel syndrome, so this is another trisomy, obviously its name. It's an extra 13th chromosome, okay, that you can see there, right? And this is that other karyotype was a female karyotype. This one's a female as well, because notice there's no Y chromosome. Babies with Patel have a cleft lip and a cleft palate. The roof of your mouth is your palate, okay? So you can kind of imagine if you did not have a full palate and it wasn't closed up, that you could stick your tongue like up into your nasal cavity. That's what that cleft is. It's a hole, okay? So the mouth and the nasal cavity are connected. They're polydactyl, so they have extra fingers. They tend to have seizures, be deaf, have some mental defects, eye abnormalities, and they tend to only live a few months. All right, so then trisomy 18 is called Edwards syndrome. So again, a non-disjunction on chromosome 18 for a total of 47 chromosomes. People with trisomy 18 have a club-shaped foot that we can see here. It's kind of turned inward. Their fingers are overlapping, right? So that's the fist of a baby with Edwards syndrome. If you make a fist, your fingers don't overlap like that. They have a short sternum, which is your breastbone. Okay, so their thoracic cavity is shorter. Typically, again, small head or face. Mental challenges, kidney and heart defects tends to affect females more than it does males. All right, so then Turner syndrome or monosomy X. So this is where we have a missing chromosome. So a non-disjunction occurred, but you have the chromosome that's missing, in this case, specifically from the sex chromosomes from the X. Okay, so we've got only one X chromosome in individuals with Turner syndrome. They tend to be short in stature, kind of have a wide webbed neck. That'll be easier to see when I put these on there in color. Underdeveloped breast tissue, they're getting basically one dose of female hormones instead of two. So they typically cannot reproduce and have their own children, but otherwise normal intelligence, lead fairly normal lives other than a few things physically that are going to impact, whether or not they have their own kids. Klinefelter syndrome, this is another trisomy. This is our last trisomy or monosomy or result of non-disjunction. So this is in males, right, where a male gets an extra X chromosome. So the trisomy deals with the sex chromosomes. They tend to have excessive breast tissue because they're getting extra female or extra hormones associated with the X chromosome, tend to be infertile. Typically they're language impaired to some extent for some reason. I've never really read up on what the situation is with that, as to if scientists really understand why they tend to have some language impairment, but they do. Tend to be kind of tall and lanky. Okay, but again, that's Klinefelter's trisomy on the sex chromosomes, where males have an extra X, so XXY. Okay. All right, so then phenylketonuria. This is PKU, right? This is an autosomal recessive disorder, so people can be either homozygous dominant, heterozygous, or homozygous recessive, so you can be a carrier for this, right? So this is when people's body cannot process the specific amino acid phenylalanine. So they have to be on a special diet from birth. When you can't process phenylalanine, it causes damage to the nervous system and can lead to an early death if a diet is not followed where there's no phenylalanine in the diet. This is one that all infants are tested for in the hospital when they're born and before they go home, so that mothers can make sure, especially if they're feeding formula. Like, I'm not sure if these are like baby formula cans or some sort of milk. I can't remember off the top of my head what the reason for that girl holding all those cans is, but they have to be on a special diet that doesn't contain phenylalanine. The picture in the top left-hand corner here is this tested by pricking the baby's heel, and then they put a little blood sample on a little card, and they run it through the machine or a machine before the baby leaves the hospital to test for this. And then this is on here because sometimes on food labels, like on diet soft drinks, it'll say contains phenylalanine. Fetal ketonurics contains phenylalanine as a warning. Okay, so the next one, achondroplasia. This is the most common form of dwarfism. There are some other ones, so this is the only one we're going to talk about. So this is an autosomal dominant trait. So that means that these people in this picture that all have this form of dwarfism, they have at least one dominant allele. They could be homozygous dominant. Okay, they might be heterozygous. Right? Short in stature, limbs are short, typically a large protruding jaw. Their teeth are typically crowded. Their forehead's typically large, kind of a bowed leg. Okay. And one thing about this picture that I kind of like to mention is that these people in the background clearly are looking at them and are just probably kind of in awe that they're seeing, 7 different people who have achondroplasia. It's an old photograph. It might be from like a traveling circus or things where people that were afflicted with dwarfism might have been kind of a sideshow historically. But as far as intelligence and just normal daily lives, they may have to have a car adjusted with gas and brake pedals being, built up some so that they can reach them. But normal intelligence and normal careers and things like that. When you have two people who are both heterozygous and they have a baby, they can have a baby that's taller than them. Okay, so like for you and I'm homozygous recessive for this, and so are all of you in my class because you are of normal stature and don't exhibit these characteristics. All right, so then the next one, cystic fibrosis. So this is also autosomal recessive, so people that are heterozygous are carriers for this. This is one that when women are pregnant, or when I was pregnant, and I assume that most doctors' offices do this, that I was asked if I wanted to be tested to see if I was a carrier for this as a white woman. And I didn't. We don't have any history of this in my family, so I just said no because I figured why get tested for something that I'm not really that worried about. But this is a defect in a protein, essentially. Causes thick mucus to build up in the digestive and respiratory tracts, so breathing problems, feeding problems, intestinal problems, kind of chronic coughing. People who have cystic fibrosis, their sweat is saltier than the average person, somebody who doesn't have this. And so a sweat test is something that's done early on if there's, suspicion that somebody has cystic fibrosis. Notice that it does say that, and then a lung transplant, if somebody needs one, that can obviously help to produce a longer life. I think the oldest person on record, I'd have to look it up and I'm just not doing that right now, is early 40s. But 30 is kind of the range that, you would say that somebody might live until without a lung transplant. Notice it says that it's most prevalent in Caucasian populations. And that's the truth. So as far as just incidence and prevalence and whatnot, we don't tend to see this in other populations quite so much. But I think that as we blur the lines more and more today than we did when I was a kid, as far as people marrying within races, that, if we were saying 100 years down the road or whatever, when we're all dead and gone, that maybe that won't be part of how this disorder and the next one are even labeled. This next one, so sickle cell anemia, it's also autosomal recessive. So people that have sickle cell have two recessive alleles. Somebody that's heterozygous is a carrier, and then of course being homozygous dominant. It's most common in African American populations because people that are carriers are immune to malaria, which is common on the African continent. Okay, so it's of an advantage from a natural selection standpoint for an individual to be a carrier. It's a disadvantage to be homozygous dominant or then to be homozygous recessive and have sickle cell. So being heterozygous is advantageous so that you can't contract malaria. If you don't know what malaria is, it's carried by the female Anopheles mosquito. It's a we'll talk about it eventually. It's a parasitic protist. In people with sickle cell anemia, their red blood cells are sickle shaped, so they're pointed instead of being rounded and looking like that kind of donut shape. Red blood cells, that's not a hole all the way through the middle. It's basically got this biconcave shape in the middle. And then when they're sickled, okay, they can get stuck in blood vessels, tear them. They don't hold they don't hold oxygen the same way because there's not enough iron attached there, and then oxygen binds to iron on our red blood cells. So anemia is low iron. So people who have this tend to fatigue really easily, just as one other quick characteristic. The next one, Marfan syndrome. So this is a mutation in a specific gene that's called the fibrillin gene. Years and years ago, I taught a student who had this. I also taught his younger brother. And the student who had Marfan, I remember, when he told me and told the class that he had this, somebody asked him what would happen if he was punched in the chest. And he said, well, it honestly would potentially kill me because they tend to have weak connective tissue associated with the heart, an enlarged aorta, which is the blood vessel that carries blood out of the heart to deliver oxygen to all the tissues, the largest artery in your body. Their chest is concave. It's kind of hard to tell from that diagram, but they have an indentation in their chest. Their spine's typically kind of curved. They have a tall, lanky build, long fingers, and it's thought that perhaps Abraham Lincoln had Marfan syndrome because he had a lot of the characteristics that would match this. Okay, so the next one is called neurofibromatosis. So neuro deals with nervous system. So this is where there are tumors that grow along nerves or nerve endings. It's autosomal dominant. Okay, so having at least one dominant allele. This man has just one little neurofibroma we can see on his cheek right there. This person has tons of neurofibromas all over their body in different sizes. Somebody typically asks me about this one, why don't they have those removed? And obviously, if you were to remove all of those, that would probably be worse than having them. This is somebody with a really large neurofibroma on the left side of his face. And then this is from a movie. This is a movie called Mask that came out when I was little, like early 80s maybe. And that the actor that we see here does not really look like that, but he has neurofibromatosis in the movie. The next one, osteogenesis imperfecta. Okay, so we're going to break this word down, or this disorder down, as far as the name first. So osteo deals with bone, okay, like if you know osteoporosis. Genesis means to form in this case, okay, think of Genesis as the beginning, okay, as far as the Bible, but here, or you can think of it as that, but here we're dealing with Genesis meaning to form, and then imperfecta means it's imperfect, okay. So people who have this, it's autosomal dominant, again, their bones break really easily. It's often called brittle bone disease. Their joints are kind of loose, their spine's curved, they typically have poor muscle tone because they have to just be really careful of doing things that might easily break bones. So when you look at this picture, this is somebody's forearms, like you can see a thumb there and a thumb there, and notice how much curvature there is to that bone. That's not normal, and this is just laid out on the x-ray with basically with pinkies together and hands face up, okay. There's a movie called Unbreakable, I think. It's got Bruce Willis and Samuel L. Jackson in it, if you wanted to just Google it, if you've never heard of it or never seen it. It's an older movie. And Samuel L. Jackson is the bad guy in the movie. I can't really remember the whole premise, but he has this disorder in the movie, and he falls down a set of stairs at some point and breaks like tons of bones in his body. And I can't remember anything else about the movie specifically. But again, autosomal dominant, bones that break easily. The next one, if you are in French, okay, then cri de chat means cry of the cat, okay. It's a specific deletion, or it's a deletion specifically on chromosome number 5. And when people who have cri de chat cry, a lot of people say that to them it sounds like a cat in distress or a cat crying. Their ears are typically low set, facial deformities, hearing and vision difficulties, feeding problems, okay, just bone structure that makes breathing and hearing and vision and feeding very difficult, and typically some cognitive and mental challenges as well. Here we can see, it's kind of hard to tell maybe on that actual set of chromosomes there that that's a deletion on the one here on the right, but now you can see it in a diagram as well. Okay, so there's the deleted segment, and then that's the chromosome that's circled right there that has the deletion on it. And then fibrodysplasia ossificans progressiva, which is a mouthful. Okay, this is super rare. It's also autosomal dominant. Fibrodysplasia means basically fibros dealing with connective tissue in our bodies. Dysplasia means it's displaced. Ossificans, that deals with that basically turning to bone or hardening, and then progressiva, that this is progressive. So this is a disorder where the connective tissue hardens or ossifies when it's injured. So let's just use this person's back as an example. Let's say that this person fell down, okay, and fell onto what would be like, that's kind of your left shoulder blade area, or a little bit below that, obviously, that causes this tissue in that area to harden, okay, or to ossify. And so that over time, people who have this, again, I can't even tell you if there's anybody recently that's been documented as having this, that essentially you can kind of think of their bodies as becoming completely rigid and immobile. All right, and so then the next one, Duchenne muscular dystrophy. There's other forms of muscular dystrophy. This is the only one that we're going to talk about. It's a sex-linked recessive trait. Okay, so for females, we can either be homozygous dominant or heterozygous. For males, you could either exhibit the dominant trait or the recessive trait. Okay, that everybody in this class has the dominant form of the trait if you are male, most likely, because you are not exhibiting signs at your age that typically males start to exhibit earlier than, than their 9th grade year of high school when they're 14, 15 years old. So this is a progressive degeneration of muscle over time. So here's just somebody that's normal, okay, as a kid. Then it progresses to walking with crutches, eventually becoming wheelchair bound, and then essentially over time, because it's a degeneration of muscle, it degenerates even the diaphragm, and sometimes, which is the muscle that controls your breathing and separates your thoracic and abdominal cavities, and that people can die essentially of respiratory failure because the diaphragm's not contracting and relaxing to control respiration. The heart doesn't continue to contract. But it's really affecting skeletal muscles early on, more so than that. And the diaphragm is a skeletal muscle. Then this one, Tay-Sachs. So this one's autosomal recessive. Excuse me, hang on. All right, sorry, I had to get some water. I felt like I was about to cough. So Tay-Sachs is also autosomal recessive. It's most common in the Jewish population, where just within that sector of the population, if they intermarry a lot and stay within just a particular sector, the Ashkenazi Jews, that we tend to see a higher incidence of this. So when we talk about this, we often talk about, are there two couples who maybe are both two people who are both heterozygous and are carriers for this because they have remained kind of in their community and married within a small group of people, and that they maybe would pass this on if they're heterozygous, pass it on potentially to their children, 25% chance of that. This is one where if they know there's a history in the family, that getting some genetic counseling might be important if they're both carriers, because if you were to both be heterozygous, you would potentially have 25% chance of passing this on to any child that you have. It's a disorder of the nervous system where fatty acids are going to accumulate in the nerve cells, and additional fatty acids are going to prevent cells from functioning properly. So notice it says it's loss of motor and mental skills starting at about 6 months of age. So we can just use, she's probably maybe a little bit older than that, but we'll just use her as an example. So let's just pretend that this picture was taken, she's just laying on the floor there in your mind, but let's say that it was taken a week after she was able to sit up, okay, and she was sitting and whatnot. Well, what happens is that slowly these kids can't do activities that they were doing, as far as a couple of months and early in birth, and that they slowly become paralyzed and tend to only live till they're about 5 years old. And so that's when, like I said, if you kind of knew you were a carrier for this is a place that I tend to talk about. Maybe this is a couple that are both carriers and are heterozygous, that they choose to adopt instead of having a child that, do you take your chances? And there's a lot of, social and emotional things with that for families to figure out sometimes when they want to have kids. And then the last one is albinism. So this is autosomal recessive. It's a defect in melanin. Essentially, the cells don't produce melanin, which is what controls our skin pigmentation. People with darker complexions have more melanin than people with lighter complexions. We all have the same number of cells that hold that melanin, but somebody who's darker than me is producing more melanin in those same cells. So people who have albinism, they lack pigment in their skin, their hair, the iris of their eyes, sometimes kind of a red color. They're really sensitive to light. Their eyes are sometimes crossed, and they have vision problems. So to be outside, it's really important for these people to be well protected with covering their bodies with a hat, long sleeves and pants, even if they're going to be in the sun a lot in the summer. Even when it's really hot, they just need to be well protected. Sunscreen and sunglasses as well. Okay, so I know this was super fast. All right, so I know that that was super fast, and it's really just mainly because of the fact that we need to regain a little bit of class time. And typically when we cover genetic disorders, because it is not a major objective in the course, we have to hit a couple of specific things with it that I tend to like to cover it because I think it's important for you to be aware of the fact that, and let me go back to albinism as an example of this. People that are afflicted with albinism, that they lead really pretty normal lives in the grand scheme of things, and could be sitting in class with you and grow up with you and be normal functional adults, where then these children are never going to live very long. And then these children might live longer than somebody with Tay-Sachs. And I'm just kind of picking sickle cell here to kind of keep with what I was saying, that that little boy, for example, that he may miss school more frequently than somebody who doesn't have sickle cell, but that he's sitting next to you in class as well and is perfectly normal otherwise, as far as intelligence and being your friend and what have you. That people who have Marfan, that they have cardiovascular issues that you might not understand, that a woman with Turner syndrome with only one X, that she will potentially never have a child, okay, unless she adopts, that people who have Edwards syndrome, that they have a lot of things that they're dealing with as far as heart and kidney defects and mental challenges and other physical things. People with PKU lead fairly normal lives. They just have to be on a special diet, okay? And that babies are tested for that, like I said, before they leave the hospital. That historically, that people who had this common form of dwarfism, that they might have been laughed at and ridiculed, okay? And that, wow, I've never seen, that's what I think those people in the background are thinking, gosh, like that's a lot of people who look really different from me. But that, again, could be in class with you, and lead a fairly normal life overall. Okay, and then if we go back to these, for example, that this is that in either the mother or the father, that meiosis did not produce normal gametes, and that an extra gamete either gets passed down to the offspring if it's a trisomy, or the chromosome or the cell that's missing a gamete gets passed down for someone with Turner syndrome, okay? And so my point in just kind of doing this quickly and going back through these is that we have truly scratched the surface, okay, but I wanted you to be aware, and just wanted you to be aware, and a lot of times too, I shouldn't just say aware, but a lot of times too that people are really interested in this, and they do know some people or know someone that has a genetic disorder. They've heard of somebody that does, they read an article, they read a book, you know, whatever it happens to be. And these are just a few of them. There are other genetic disorders out there, but these are some of the more common ones, or the ones that people have heard of, or that we can plug very easily into. It's either autosomal or it's sex-linked. It's either dominant or it's recessive. It involves a single gene or a whole chromosome, for example, okay, or like Creta-Shot, missing a section of a chromosome that would contain multiple genes. So if you have any questions, let me know. You are going to use your PowerPoint notes. I'm going to put them in color on Google Classroom too, and this lecture video to complete the Google form about the genetic disorders, just to get you to go through it again and to address the things that will show up on your test, which I'll explain when I'm posting things about the test. If you have any questions, let me know.